everyone, and welcome to our eLotus webinar. My name is Lee, and today I will be your host and moderator. You can download today's lecture notes for free if you have an account with eLotus. If you don't have one yet, you can sign up for free at eLotus.org and receive a gift for one free after you have verified your email. You can find the lecture notes for this webinar on the blue course page. For over 2 decades, eLotus has been the trusted source for continuing education for acupuncture. We offer the largest selection of online CEU courses with over 3,000 hours of video recording. This weekend, we will be hosting 2 live classes with Dr. Call on body mapping acupuncture and muscle tapping. Saturday's class will focus on head and neck pain, and Sunday's class will focus on back and hip pain. So hopefully you don't forget to sign up for these classes. If you are interested in Dr. Call's body mapping technique or would like to learn more, we'll also offer many of his classes he had previously taught and are available now for distant learning, which you can enjoy at any time and at your convenience. All right, before we get started today, Dr. Call, are you able to do a quick sound test?
Test. Hello? How's the sound, everybody? Okay, now.
Ready? Oh, great. Please go ahead and start it, Dr. Cole. Thank you.
Okay, thank you. Hello, everyone. Let's get a quick count of new here. So how many new people do we have today? Meaning new to me, like haven't seen any of this body mapping acupuncture or distal. New. 1, 2, 3, 4. So have you guys ever seen Richard Kahn's information or distal acupuncture, channel relationships, that kind of thing? Some yes. Tung and distal, great. Okay, so for some of you this will be new stuff, it looks like. For some of you this will be old stuff, my version of it. So I won't bore you with my details of 14, great. Details of my history, but really quick, I've been doing this for about 20, 25 years. Originally saw Ton come to Oregon at OCOM in 90s, must have been 4. And I've basically been doing his early stuff from the beginning, which is just a channel relationship. So what I bring you today is I've sort of gone in the direction of anatomical correspondence, meaning relating bones on opposite sides, relating muscles on opposite sides, and then and how to treat that, and how those images and associations work. This seminar coming up and today a little bit is going to be about the origins, the insertions, the belly of the muscles, strategies for approaching how we treat those. And then how do we, if we can get to the muscle, if it's a more superficial muscle, we can then kinesio tape it, which is, they just called it taping, but it's actually that stretchy elastic tape. So we're going to talk about that a little bit. I find that very useful in specific conditions. And especially in today's condition, we're going to talk about tennis elbow or lateral epicondylitis, the muscles associated there, and then how to tape that. And maybe I get to demonstrate on my lovely wife over here. So let's jump into it, and then I'll hopefully we'll have a little time for questions if anybody has any. So let's jump into, so here's the chart I like. Darn it, can you grab me a chart really quick? So this chart I developed years ago while working at OCOM and teaching there, and basically I wanted to know where the channels exactly went, not where the lines and dots were, but where's the influence of the channel, like how wide does that stomach 36 go? How wide does the, we have laminated versions of this, by the way. How wide does the stomach channel go on the chest? You know, there's kidney, and then there's stomach, and then there's PC, maybe a little lung up here. Where exactly are those? Like if you're in between channels, what do you do? What channel are you trying to treat, say, if you're in between? So that's what this chart is about. It's creating an entire covering. Some of this is three-dimensional, so there's layers to it. So if you're interested in more of that information, we go deep into that in previous seminars. This today and this weekend is going to be more of an advanced, where we leave most of this behind. It still gives us a good, we'll refer to it some, but we go more directly into the anatomy of it and how those relate. So if you'll also notice on this chart, not only do we have the body in the front and the back and the side, we've got separate head images here, which is kind of a zoom in on the head. We've got also the channel relationships listed here, and these have been taught by lots of people. My first exposure was Richard Tung. So these channel relationships down here I use two main ones, and the two that I like are the name pairs. That would be the Chinese name pairs. So Yang Ming, hand and foot treat each other. Tai Yin, hand and foot treat each other, right? So Yang Ming in this today, that's going to be appropriate. Yang Ming is name pairs. Anybody want to throw that out for us real quick? So make sure you're on the same page with me. What are the name pairs of Yang Ming? What are the two channels that would treat each other? Anyone? Couple typing here. Stomach, large intestine, thank you very much. So Tai Yin, Blythe can relate with Yang Ming, yes, if you're doing a yin and yang balance. In this case, we're using the two channels of Yang Ming to treat each other. So in this case, Yang Ming would be hand channel, large intestine, foot channel, stomach, right? So that means large intestine channel treats stomach channel and vice versa. Stomach channel treats large intestine channel. And that works for me specifically on the extremities. So from the shoulder down, hip down, if you're got a Yang Ming channel problem on say the knee, stomach 36, 35-ish, then large intestine channel on the arm, elbow would be the most appropriate knee reference. So elbow is going to be LI something around 11. So that would be a great reference, which this is something we're going to use today. So that's basically the idea of the name pairs. The other channel relationship here is across the clock. So this is laid out in a clock. Heart up here at the top, that's noon, right? Gallbladder down here at the bottom is midnight. So it's a 24-hour clock, so every channel gets 2 hours, around you go. And it's the opposite on the clock that we would pay attention to. So not so much caring exactly the time of the day, but more the fact that it is opposite. So heart opposite with gallbladder, meaning they can treat each other. So heart treats gallbladder, gallbladder treats heart. Channel, right? Not necessarily organ relationships, but channel relationships. So that I find more useful for the torso part of the body. So from the pelvis all the way up to the head. So everything other than the extremities. So the extremities, arm, leg, clock name pairs, and then the rest of the body, the torso, clock opposite. All right, everybody with me so far? We'll just move along. This is a brief little review for those of you who have seen this. Those of you who haven't, we're going to move kind of quickly. So if you need to brush up on this information to be into the seminar this weekend, I'd say go back and watch one of those previous seminars on BodyMapping Acupuncture. The first one I did 2017 or 2018. There was one for quick, effective pain. So here we are in this image, extremities up here at the top. Again, extremities being name pairs. I've listed it for you. This is also on the back of same laminated chart, right? So laminated chart front, you get the images. Laminated chart back, you get the channel relationships, and it's nice and flexy, so you can take it with you. Lotus has these for you, so you can look them up online. We also have all of those in said book. Right? There's a little bit of a book. They also carry a book for us, front and back on the book. Though I would say if you really want this image, the chart is the best way to go. The book has more of the specific layouts of the information. So we kind of go into detail on the relationships, and then specifically into detail on the muscles, and then there's a whole bunch of points listed, and favorite points, and then how to use those. So that's what the book's about. I'll do another one in the future that'll be even more in depth on the muscles, which is what this seminar is about, actually. So name pairs again for extremities, and then clock opposite for the torso, and also a separate head image for clock opposite. So we're not going to go too deep into these today. We've done this previously, so I don't want to bore those of you who've been following along previously. And those of you who are new, again, this is covered on the previous seminars. The front and the back image gets useful. We're going to use that a lot in this seminar coming up. Today we're talking about extremities specifically because we will be discussing lateral epicondylitis. So first of all, kinesio tape. What is kinesio tape? So it's this really interesting, cool tape. If you've never seen it, it is a kind of a muscle tape stuff. Let's see if we can get that. Oh, it's so bright. Sorry. Kind of a muscle taping that that has elasticness to it, right? So it stretches. So let me just pull out a piece here, and there's a backing to it. If you've never used it before, there's a backing on it, and there's a flexible, cotton tape, and it has a acrylic adhesive, so it's non-allergenic. So typically people don't have allergies to this tape, which is great. Occasionally you'll find somebody that if you stretch the tape too much, when you put it on, it'll irritate the skin, but that's usually from the amount of stretch you've used, not the actual adhesive. There are a few patients who do have the adhesive problem. It is wearable for many days. You can leave it on for 3, 4, 5 days. I've had a patient even go a week with it. It can get wet. It does get wet, and it kind of soaks into it, but then it just dries out again. So that's fine. That won't peel it up. We typically will round the corners. Usually the tape comes in a roll. You can get some that's pre-cut and you just kind of snap it off. I like the stuff in the roll because then I can cut my own length. But so you see the edge, when you cut it off, it's just on a roll. So you kind of need to round off the corners. Otherwise, the edges that are sharp will tend to peel up even just in a few hours. Or if it's on clothing where the clothing rubs, it'll kind of peel up a little bit. So rounding corners is important. So we just fold it and trim it with the scissors. Nice sharp pair of scissors, by the way. Dull scissors do not cut this stuff at all. Everyone can use it, so kids can wear it, adults can wear it, old, young, any age. It's great. It's just on the skin. If something goes wrong with it, we can just, if they don't like it or it's irritating them, they can just pull it off. It's not a permanent thing. And also doesn't change the range of motion. So if you're taping someone's knee, for example, and you're like, they want that range of motion, it's great for like athletes or somebody who's doing sports. That's why you see it on lots of sports people. Made famous in the Olympics recently. Last Olympics, lots of people were wearing the tape. You see sports athletes, all kinds of pro people wearing this stuff. Made famous, really famous by the volleyball players, those the sand, the two-person, the women's team we had in the Olympics, they wore a bunch of tape on their shoulders and back, and quite useful. My patients really like it. So that's what kinesio tape is. And next one's going to be where did it come from. So short history, guy named Dr. Kenzo Case, Japanese chiropractor in Japan, developed this stuff. I don't know how he came up with it. I guess he's kind of an inventor, it looks like. And so there he is taping a guy on his shoulder. He's doing a kind of a deltoid, possibly a bicep. Looks like a deltoid tape there. And anyway, he developed it and was looking for a way to extend the benefit of his chiropractic adjustments. So yes, the book, name of the book is BodyMapping Acupuncture Technique. It's on there. I think they just showed you. They've got it here on eLotus. So BodyMapping Acupuncture Technique, and in the spirit of Master Tung, because that's basically where all this distal stuff kind of started for me anyway. I again, originally learned from Master Tung, but he talked about Tung the whole time he was teaching, and those points are great. So the Tung points are wonderful, and I use many, sometimes in a different way. So continue on. So we're taping with this tape. We're usually going along muscles, over attachments of muscles. I often like to extend the tape. You might, like I said, we're going to be taping the elbow today, so we'll come to that lateral epicondyle, but we might extend past that and tape across the epicondyle. We might go all the way down to where those muscles are attaching on the base of the metacarpals here. We might go past that onto the hand, back of the hand. That's a nice way to tape it. If there is significant hair, sometimes the tape will, wax that off. So a new form of waxing for those of you looking for that. Otherwise, you might shave it if it's real thick hair. If it's not too thick, usually it tapes on just fine. So just on coming off again. So over attachments, you can tape around a joint, around joints, Around a knee is nice. You can go around the patella, top to bottom. There's nice ways. We'll talk a lot about taping the knee let's see, we're doing lower body on the second day. So Sunday we're doing knee, and there's inner knee, lateral knee, there's patellar tendon, there's just knee support in general. There's back of the knee, so there's a number of ways to tape. We typically will avoid taping right over a crease. So if you're doing the bicep, say, you might come down the bicep, but you wouldn't want to go right over that crease because that kind of just gets uncomfortable. So usually we'll stop it just before the crease, or you split the tape and go around that attachment maybe. That's another option. So that's a way to go. Uses of the tape. It does do very nice support. The research, funny enough, isn't that great on kinesio taping. I don't know if the researchers aren't looking at it the right way, or they're trying to prove it does everything under the sun, curing cancer, etc. But it really does seem to support well, like all kinds of muscle taping does. This support, though, is a stretchy support. So if you stretch the tape and you stick it on, as soon as you release it, it shrinks, right? Because the adhesive is pulling it. So as it's shrinking, as you can imagine, it's kind of like squeezing, right? Squeezing the skin up, right? So as it squeezes the skin, that squeezes the flesh, squeezes the fascia, squeezes the muscle a little bit. So it gives you a little space, right, inside. So that might increase blood flow. It might relax an attachment at a bony prominence, right? So the muscle, so that attachment, in staying in constant relaxation, can just get a little more time to heal. That isn't constantly being pulled on, say, by a tight muscle, for example. It creates some sensory awareness. So that sensory awareness is it makes people aware of there's something on my skin that doesn't feel, oh yeah, I should be more upright in my posture. Say if it's back pain we're treating, right? So you might run some muscles along the erector muscles there, the erector spinae, and then you might stretch it and stick it on, or put them in a flexed position, and then lay the tape on, and then when they come upright, it just stretches it up. And then it just gives them this awareness that there's a little bit of something happening in their back, almost like wearing a brace, temporarily, of course. And then that makes them aware of that spot, so they're careful with it. They don't overstretch, they don't overuse. So that awareness is very useful. And again, that creating that slacking motion, whether that is increasing blood flow, lymph flow, just decreasing the stress on a bony prominence, all very useful things when we're trying to treat things that are pain on a bony spot. So
Thank you for attending today's class. We hope you find it useful for your practice. If you enjoyed today's webinar, don't forget to sign up for Dr. Call's full day classes this weekend, October 26th and 27th. Today's webinar has been recorded, so if you'd like to watch it again, you can log into your eLotus account and find it in our TCM Wisdom Cube tomorrow afternoon. Thank you, Dr. Call, and thank you, everyone. Have a wonderful rest of your day. Thank you. Bye.